Before we go further, subscribe to this channel because today's message may completely change the way you think about blood pressure after age 70. Because if you have been told that there is one magic number, one perfect reading, one neat little answer for every older adult between 70 and 85, you have been told something dangerously incomplete. And that incomplete advice is hurting people every single day. Right now, somewhere, an older adult is being told their blood pressure is fine, when it is quietly damaging the brain, the kidneys, and the heart. And somewhere else, another older adult is being pushed so low with medication that they are getting dizzy, weak, unsteady, and just one fall away from disaster. I'm Dr. William Lee. Please subscribe to my channel. And today, I want to help you understand which readings actually matter, which ones you can ignore, and the truth hardly anyone explains in plain terms. Please subscribe for practical, life-saving health guidance. It helps you safeguard your heart, your brain, your blood pressure, and your everyday independence. Now, here is the question that fills so many people with worry. If you are between 70 and 85 years old, what is the ideal blood pressure reading? Should it be 120 over 80? Is 140 over 90 acceptable? Should you aim for 150 simply because you are getting older? Or should you push for lower values to lower your stroke risk? The truth is, there is no universal number that fits everyone, and that is exactly why countless older adults end up confused. Your age definitely plays a role, yet age alone cannot tell the whole story. Your balance function, kidney health, memory status, current medications, whether you get dizzy upon standing, and whether you are physically active or physically frail, all make a huge difference. The optimal blood pressure is not just the lowest figure you can get on a monitor. It is the lowest safe reading that protects your brain and heart without causing other parts of your body to suffer negative side effects. Let me illustrate this point with real-world patient stories. Eleanor was a 74-year-old woman living in California. She was sharp-minded, well-organized, self-reliant, still drove her car, tended her garden, and looked after other family members. Her blood pressure used to sit in the 140 range, and she hated seeing those numbers. She learned from friends, television, and online content that lower blood pressure was always better. So after her doctors adjusted her medication and her readings dropped to 116 over 64, she felt a strong sense of relief, thinking she was finally getting her health under control. But trouble was brewing underneath those promising numbers. By late morning, she would feel worn out. When she stood up quickly, the room would feel like it was spinning. She stopped taking walks outdoors because she no longer trusted her legs to hold her steady. One day in her kitchen, she nearly passed out while reaching for a drinking glass. On paper, her blood pressure looked excellent, yet her body was sending clear warning signs that it had dropped too far. What truly alarmed me about Eleanor's case was that medical staff initially overlooked her symptoms, fixated only on the favorable lab numbers. This scenario happens far more often than most people realize. Many people see a reading of 118 over 66 and automatically assume everything is perfect. But if that reading comes paired with dizziness, physical weakness, near falls, or actual falls, then that number is not ideal for that individual. It can actually be dangerous. This risk rises especially when the diastolic, or bottom number, gets driven down excessively. Your organs require steady blood flow not only when your heart contracts, but also during its resting relaxation phase. For some older adults, if the diastolic value falls too low, the heart and brain may not receive adequate blood supply, no matter how good the monitor output appears. So if you retain only one takeaway from this video, remember this. The best blood pressure is not the most attractive number on screen. It is the reading you can comfortably live with while staying safe. Now let's examine the opposite end of the risk spectrum, because dangers exist on both sides of the scale. Joseph was an 81-year-old man from Alaska. He was tough-minded, stubborn, and valued his independence. He would always say, "Doctor, I feel perfectly fine, so there is nothing wrong with me." His home blood pressure readings repeatedly landed at 152, 156, 148. Yet his diastolic number usually stayed around 70, so he chose to disregard those high systolic values. Like many people his age, he mistakenly believed only the bottom reading really mattered. He told himself this was just normal for older adults, that only the top number was slightly elevated. That misguided belief almost ruined his quality of life. After age 50, and especially in later life, the systolic reading often gives the clearest warning of stroke risk, heart strain, and arterial stiffening. Joseph never experienced obvious painful symptoms. Silent, untreated high blood pressure slowly damaged his blood vessels month after month. This is the trap so many elderly people fall into. High blood pressure is widely known as the silent killer, precisely because it rarely creates obvious warning signs. It does not always trigger pain, headaches, or general sickness. You can feel completely normal while your risk of stroke, heart failure, kidney injury, and cognitive decline steadily climbs. That explains why deciding your target blood pressure for ages 70 and above cannot rely solely on how you feel. Feeling fine is no proof your blood pressure is safe. Similarly, a low reading is no guarantee everything is working perfectly. You have to look at both the numerical results and your physical symptoms. You need both the measurement and the full personal context. Most importantly, growing older does not grant you immunity from high blood pressure. In many respects, aging makes proper blood pressure management even more critical. Let's start with the concise answer many viewers came here seeking. For plenty of healthy, self-sufficient older adults aged 70 to 85, the general target is keeping blood pressure below 130/80, or aiming for low 130 systolic values, provided your body tolerates this target well. Tolerance means no dizziness, no persistent weakness, no frequent falls, no worsening kidney function, and no major blood pressure drop every time you stand up. This is the guideline many cardiologists follow for older adults who live independently and can handle medical treatment well. But here is a vital caveat. Not every person between 70 and 85 should aggressively push their numbers down to this level. If you are over 80, physically frail, prone to lightheadedness, taking multiple prescription drugs, living with kidney disease, or prone to blood pressure drops upon standing, your ideal target might sit somewhat higher, usually around 130 to 140 systolic, so you stay safe and maintain normal daily function. Many people dislike this kind of flexibility because they want one fixed, unchanging number to follow. Yet geriatric medicine simply does not operate that way. A fit 72-year-old who walks daily, handles finances, cooks and shops independently, and tolerates medication without side effects is entirely different from an 84-year-old dealing with balance loss, weight loss, multiple prescriptions, and regular dizzy spells. Recommending exactly the same target for both groups would be careless. That is why I encourage you to stop asking, "What number matches my age?" Instead, start asking, "What range will protect my body without creating new health problems?" That is the smarter, more mature question to ask, and it helps you avoid both undertreatment and overtreatment. Let's break down why the top systolic number becomes so meaningful as we grow older. Once you understand this mechanism, the whole topic of blood pressure becomes much easier to follow. As you age, your large arteries gradually stiffen and lose the flexibility they had in younger years. When your heart pumps blood, the pressure surge hits blood vessels that can no longer cushion that force effectively. The end result is your systolic reading rises, while diastolic may stay unchanged or even drop. This condition is known as isolated systolic hypertension, and it is extremely common among seniors. It is far from harmless. In fact, it is one of the most prevalent forms of high blood pressure in older populations. So whenever a patient tells me their diastolic number looks normal, so they are not worried, that is exactly when I start to worry. 76-year-old Robert from Chicago held that exact misunderstanding. His typical readings were 149/68, 152/70, 147/66. Looking at those lower diastolic numbers in the 60s and 70s, he felt reassured and convinced nothing was wrong. But his arteries told a different story. That wide gap between systolic and diastolic served as a warning sign of stiffening, aging blood vessels. I want to make this clear. Not every wide pulse pressure equals an emergency. Still, it deserves proper medical attention and careful evaluation, far more consideration than most people give it. Robert finally took this seriously after his wife noticed he would get short of breath walking up hills he once climbed with ease. His blood pressure had been sending warning signals long before he developed obvious physical discomfort. That said, I do not want you walking away thinking only the top reading matters. The diastolic number also counts, especially when medications drive it excessively low. One major concern medical experts highlight for older adults is the risk of lowering diastolic pressure too far. When I see an elderly patient with readings like 122/58 who reports exhaustion, brain fog, or dizziness, I do not celebrate those low numbers. Instead, I start asking important questions. Are we over-medicating this person? Does their blood pressure plummet upon standing? Is their heart forced to work with a resting pressure it cannot comfortably tolerate? A low diastolic value is nothing to fear if you feel perfectly well and your doctor approves. But you must pay close attention whenever uncomfortable symptoms appear. This brings us to one of the most overlooked realities in geriatric blood pressure care. The reading you get while sitting in a chair is not always the reading your body experiences when you stand upright. 79-year-old Maria from Delaware illustrates this perfectly. Her seated blood pressure looked nearly perfect, yet as soon as she stood, her blood pressure crashed sharply. Getting out of bed at night and taking just a few steps would make her feel as if the floor was shifting under her feet. No medical staff caught this issue because nobody bothered checking her standing blood pressure. Everyone only reviewed her seated measurements. A sharp drop in blood pressure when standing raises risks of dizziness, fainting, and falls. For older adults, a fall is no trivial incident. It can completely alter your life. Loss of self-confidence, reduced mobility, loss of independence, surgeries, lengthy rehabilitation, and persistent fear of moving around. So whenever I am asked what blood pressure target works best for ages 70 to 85, I always ask one follow-up question. What happens to your readings when you stand up? This question carries huge importance, since many seniors appear well controlled until gravity comes into play. A reading that looks excellent seated can turn dangerous in real-life situations if it drops too much when you rise to your feet. This explains why many doctors check both seated and standing blood pressure, especially for seniors who are frail, experience dizziness, suffer dehydration, live with diabetes, take multiple medications, or use drugs that impact circulation. If standing triggers a steep blood pressure drop alongside lightheadedness, your entire target goal needs reevaluation. Numbers written on paper are no longer sufficient. Your body's physical response becomes a core part of assessment, and this reinforces why there is no universal perfect blood pressure for every 70 to 85-year-old. The correct target has to hold up under real-world daily conditions. You might be wondering whether lower targets actually deliver real benefits for older adults. The answer is yes for many individuals. Large-scale clinical research shows that for many community-dwelling older adults in good health, bringing systolic pressure down toward the low 120s or below 130 reduces major cardiovascular events and lowers mortality risk compared with less strict management. That is, the positive finding many people hear about. What often gets left out is that these studies do not mean every older person must aggressively chase a 120 reading at all costs. Many of those research trials excluded high-risk patient groups. Real-world elderly patients are more complex. They may have diabetes, past strokes, advanced frailty, cognitive impairment, fragile kidney function, or overlapping drug interactions that make paper-perfect targets harmful in practice. So I want to state this plainly to help you avoid serious mistakes. Do not treat 120 like some sacred benchmark. Do not feel defeated just because you get a reading of 128. Do not keep pushing for ever lower numbers if your body is sending clear warning signals. Systolic pressure in the 120 range can be fantastic for some older adults, yet overly aggressive for others, particularly when symptoms show up or diastolic values sink too low. Meanwhile, readings in the 130s can be safer and more sustainable for older, frailer, or medication-sensitive people. This is why ideal blood pressure is not a trophy to chase. It is a functional, protective measurement that lowers your stroke risk without raising your fall risk. Here is a practical framework you can follow. If you are a healthy, active, independent older adult in your 70s or early 80s and tolerate treatment well, aiming for below 130/80 is very reasonable. If your systolic consistently lands in the 120s or low 130s and you feel energetic, mentally sharp, and physically stable, you are likely in a very good spot. But if you are over 80, medically frail, or highly sensitive to medications, most clinicians will feel more comfortable with systolic targets between 130 and 140, as long as you remain safe and stable. This higher target is not giving up on your health. It is making wise, safety-first choices. Preventing stroke matters greatly, but so does preventing dangerous collapses. 84-year-old Dorothy from South Carolina taught me this invaluable lesson. She was small-framed, strong-willed, and terrified of having a stroke after watching her sister suffer one. She insisted on pushing her blood pressure as low as possible. Every time her systolic reading climbed above 130, she would panic. Her doctors repeatedly intensified her medications until her seated numbers looked impressive. 121 over 61. 118 over 60, 116 over 58. On paper, this looked like total success. In reality, it created real-world danger. She began shuffling around her home, constantly grabbing furniture for support. She stopped attending church because she feared standing after long periods of sitting, and she narrowly avoided a bad fall inside a grocery store. What she needed was not more aggressive treatment, but a more reasonable, safer target range. We eased back on her medication, and her systolic stabilized in the mid-130s. She regained steadiness, physical strength, and self-confidence. Her optimal blood pressure was not the lowest possible reading. It was the one she could truly live with. I wish more medical professionals and patients would use that phrase, livable. Managing blood pressure is not some abstract numbers game. It is about preserving the quality of your daily life. Can you get out of bed without feeling completely drained? Can you walk to your mailbox without fearing you might faint? Can you think clearly? Can you shower safely? Can you rise from a chair without your vision fading? These questions carry equal weight to whatever your blood pressure monitor displays. If your treatment plan achieves textbook perfect numbers, yet robs you of balance, confidence, or energy, something has gone wrong. A proper blood pressure target protects your organs while preserving your physical function. It keeps you alive and keeps you fully yourself. Let's clear up another widespread source of confusion. Many people ask, what does it mean if my blood pressure reads 138 over 78? Is that something terrible? Not automatically. Modern diagnostic standards may classify this as hypertension, yet real-world interpretation depends entirely on context. Was this a one-off reading taken after stress, high-salt meals, poor sleep, or rushing around? Or does it reflect your true average from multiple calm, properly taken home measurements? Are you a robust 71-year-old or a frail 84-year-old? Do you experience dizziness? Are you already taking 4 different medications? A single isolated reading cannot define your health condition. Reliable blood pressure assessment looks at long-term patterns, not panic over one abnormal result. I trust 2 weeks of careful, calm home measurements far more than one rushed reading taken while you are stressed or distracted. It is critical to understand that measuring technique directly impacts results, and poor measurement practices cause countless people to react to completely false readings. Seniors especially need accurate measurements because treatment decisions carry higher stakes consequences. If your monitor falsely reads 144 when your real average sits at 128, you might end up taking unnecessary medication. If it falsely reads 126 while your actual average is 148, that false sense of security leaves dangerous high blood pressure untreated. So remember to sit quietly for 5 full minutes before measuring. Empty your bladder beforehand. Keep your feet flat on the floor. Position your arm level with your heart. Use a properly sized cuff against bare skin, and take multiple sequential readings. Good medical decisions can only come from good quality data. There are no shortcuts. Now I will walk you through 5 practical blood pressure zones every older adult should understand, so you no longer need to guess what your numbers mean. First, the healthy, favorable zone for many older adults. Systolic in the 120s and diastolic below 80. This is excellent if you feel well and tolerate these levels. Second, the frequently acceptable common zone. Systolic in the low to mid 130s, particularly for older or more vulnerable individuals. For many seniors, this represents a smart, safe target. Third, the pay close attention zone. repeated readings of 140 systolic or higher. This warrants serious conversations regarding lifestyle adjustments and medical treatment and should never simply be ignored. Fourth, the potentially too low zone. Readings that appear low paired with dizziness, weakness, fainting episodes, or falls. Fifth, the emergency zone, and please listen carefully to this warning. If your blood pressure goes above 180/120 alongside symptoms such as chest pain, shortness of breath, severe weakness, speech difficulty, numbness, vision changes, or intense back pain, do not waste time searching online for answers. Do not wait around hoping it will pass. This constitutes a hypertensive emergency that requires immediate medical care. Even if you hit those high numbers without noticeable symptoms, you still need prompt medical advice and repeat resting measurements, as those levels are inherently dangerous. Older adults often tend to downplay serious warning signs to avoid bothering others, trying to be brave at the wrong moment. True bravery is seeking urgent care before you suffer a stroke, heart failure, or other catastrophic health event. Next, we need to cover low blood pressure symptoms, something many seniors underestimate. Most people only worry about high blood pressure, yet low blood pressure can also create serious risk. Dizziness upon standing, unusual fatigue after taking medications, unsteadiness during showers, blurred vision when getting out of bed, repeated falls, and persistent morning exhaustion are not trivial complaints. They may signal that your blood pressure or medication dosage is too aggressive for your body. Families often mistakenly write these symptoms off as normal aging. Frequently, these issues stem from mismanaged blood pressure disguised as old age decline. Also pay attention to hydration, meal timing, and medication schedules. Some older adults develop unstable low blood pressure right after eating. Others become dehydrated without noticing because the body's thirst signal weakens with age. Multiple medications can combine forces to drop blood pressure too far. Some people skip meals, take their pills on an empty stomach, and then feel terrible without understanding why. A monitor alone cannot capture all these variables. You have to look at long-term patterns and personal context. When exactly do your symptoms show up? In the morning? After lunch? After standing for a long time? After taking your second daily pill? After spending time gardening in hot weather? These details are not irrelevant background noise. They are vital clinical clues explaining why textbook perfect numbers can leave you feeling awful in daily life. Now consider the situation of older adults whose readings remain persistently high, yet keep banking purely on lifestyle changes to fix everything. Lifestyle adjustments absolutely deliver meaningful benefits, and I strongly recommend them. Cutting sodium intake, consistent walking, sensible weight loss if needed, improving sleep quality, treating sleep apnea, managing stress, and taking prescribed medications reliably all make major differences. But if your consistent real-world average sits in the 150 range, telling yourself you will just eat more fruit and wait for improvement is not a valid health plan. It is avoidance. The longer high systolic pressure persists, the more damage it inflicts upon blood vessels serving your brain, heart, kidneys, and eyes. Needing blood pressure medication is not personal failure. It is appropriate medical treatment, and countless older adults thrive once they find the right medication regimen. At the same time, medication should not be used as an automatic quick fix. If your readings are borderline, inconsistent, your home testing technique is flawed, you show signs of over-medication, or you are already taking multiple drugs, adding more pills is not always the correct next step. Sometimes you need better quality measurement data. Sometimes adjusting the timing of your doses works better. Sometimes checking standing blood pressure gives new insight. Sometimes simplifying your medication list, fixing dehydration, or correcting extreme sodium intake solves the problem. Good blood pressure care is not simply higher numbers equal more pills. It means recognizing patterns, balancing risks, and treating the whole person in front of you. I also want to touch on independence, because this topic extends far beyond heart attack prevention. It protects the ordinary daily life you value deeply. High blood pressure raises stroke, heart failure, kidney disease, and long-term cognitive decline risk. On the other hand, overly low blood pressure threatens independence in other ways, through falls, weakness, confusion, and fear of moving around. So the ideal blood pressure for seniors lowers future disease risk without robbing you of your present-day physical function. That balance is where the real skill and wisdom of geriatric medicine lie. When people oversimplify this topic down to one universal magic number, They ignore the real-world bodily trade-offs older adults face. Medical advice that ignores those trade-offs becomes dangerous. To be as practical as possible, if you consistently see systolic readings between 145 and 155, do not convince yourself this is normal just because you are old. It may be common among seniors, yet common does not equal safe. If you sit steadily in the 120s or low 130s and feel great, that is likely a very good place for you. If your readings land in the 100s over 50s and you feel terrible, do not let anyone convince you those numbers automatically mean success. If you are 84 years old, stable, mobile, and doing well with readings in the 130s, that may be exactly your personal target. These fine distinctions separate raw statistical data from real clinical judgment. Imagine two 83-year-old women. One walks a mile each morning, cooks, drives, volunteers, and tolerates medications with zero side effects. The other uses a walker, has fallen twice, eats poorly, and gets dizzy on just one medication. If both show a systolic reading of 136, I would not treat them identically. For the first woman, we could cautiously aim a little lower if all other factors support it. For the second woman, I would be extremely hesitant to lower her pressure further and risk losing her stability. This is why copying your friend's target values, your neighbor's medication, or your spouse's readings is such a poor idea. Blood pressure management is deeply individual. The exact same reading can signal safety for one older adult and risk for another. So circling back to the original question, what is the best blood pressure for people aged 70 to 85? My clearest answer is this. For many healthy, independent older adults, the sweet spot is usually below 130 over 80, or systolic in the 120s to low 130s, as long as your body tolerates those levels well. For some adults over 80, especially those who are frail, prone to dizziness or falls, a systolic range of 130 to 140 may be safer and more realistic. In every scenario, do not casually accept repeated readings in the 150s. Do not ignore values above 140. Do not aggressively chase the lowest possible number without considering symptoms, and never brush off physical symptoms when blood pressure is pushed downward. Exercise caution whenever diastolic pressure drops too low, particularly if you start feeling unwell, and always pay attention to how your numbers shift when you stand upright. This is the truth hidden behind oversimplified online headlines. Protect your physical balance just as fiercely as you protect your arteries. And always remember, the best blood pressure helps you stay alive, stay mentally sharp, stay physically steady, and remain fully yourself. Take care, and I will see you in our next video.